What's up guys, Dr. Nick here to explain how we are going to treat this ankle dorsiflexion range of motion problem. We're going to attack it three ways: by a release technique, a stretch technique, and a joint mobilization technique. First off, the release using the foam roll. We're going to target the back side of the calf. Mainly two culprits that get blamed is the gastroc and the soleus, two calf muscles that help plantar flex the ankle, but they do other jobs as well, and there's other muscles in the back portion of the ankle, but those are the two that typically get blamed. I'm going to show you how to foam roll first. Here's how it looks. If we're doing the right leg, arms forward and to the side, not splayed out, because that will create some neural tension and some shoulder discomfort. Hands by side, facing forward. Foam roll starts right at the musculotendinous junction at the bottom portion of the leg, basically in the Achilles tendon above that. Cross the other leg over. You're going side to side, and you're moving your ankle up and down, up and down. Plantar flexion, dorsiflexion. Circles clockwise and counterclockwise until you feel like the kinks and the tender spots underneath where it's being compressed are kind of releasing. Then you take your other leg, move the foam roll up to the next segment. Side to side, up and down, circles, next segment. You repeat that until you go through the entire lower portion of the leg. So we are getting at the restrictions that could be limiting the motion of the ankle. Simply being on the foam roll and just going up and down is not doing much at all. You need to create relative motion in between the structures of the tissues. By doing that pin and stretch method, you're biasing more of those restrictions in the leg to lengthen actually. Dosage on that is roughly 2 minutes. Why? In the literature supported that 2 minutes is the minimum dosage you need to basically tell the tissues, hey, this is what I want you to do. Anything less than that, you're pretty much not talking to anything. Personally, I think you need more than 2 minutes, so multiple bouts throughout the day is obviously beneficial. Next technique, stretch technique using the wedge. Very common to see this exercise. You're placing your leg flexed side on the wedge, heel stays down, remains on the wedge. We're going to start with the knee straight. Opposite leg just balances, and you're just leaning into the stretch until you feel a stretch on the back portion of your leg. Knee is straight for gastroc. Knee is going to be bent to bias the soleus muscle, which does not cross the knee. So having it bent, you bias more of the soleus. Again, dosage is the same, 2 minutes, 2 minutes. Lastly is the joint mobilization technique. You're placing the band right below the two bones on the inside of the ankle and the outside of the ankle, right below that. Get enough tension, bring it out, balance. You're going into the range, heel remains on the floor. You can oscillate at end range, come in and out, in and out. Hang out here for a second, oscillate, in and out, in and out. So there you have it. You have three techniques that you need to focus on. Releasing, then to the stretching, then to the joint mobilization. Do that multiple times a day, and you'll feel the difference and let your ankle start to become an ankle and function like an ankle. See you next time.